chirik mes charit ka yugen no kamen ta yugen jor di la chwe de ente misel ji salad mi de kap ka ji ke yo di zil kwarenta
ana ne chol marial wana ne pur ene ana mu en war chan pur abore che podi chiraj wana nong diar kangwan kwana nong metiar kan war chi gan pur abore che bana che ba cha chiraj a che ka diam fe men chi ke ria ga UN che mena ke thiok che ban ta yen thiok kalom ene atinge nong ku lo ko nya go.
CRS has a long history of working in South Sudan, dating back to prior to independence. Across the country, we work on saving lives and alleviating suffering, but also working with communities to take development into their own hands. What's unique about CRS's partnership with the World Food Programme is that we go together to the areas where needs are greatest. We saw that in 2019-2021. We went together to communities impacted by widespread flooding and continued to provide food to feed those experiencing hunger. I think strategically the investments that we're making in addressing food insecurity also has an impact on providing or strengthening social cohesion in communities, but also creating a pathway for prosperity and resilience.
La wo chieng gwa ma chel ma cham ga lieb ko ne go ma cha ka ba kat mem de cha let ga woni chi ko kan te ro lat.
CRS has been implementing general food distribution in Lakes, Ayod and Akobo to the IDPs, internally displaced people. Also been doing BSFP, that is a blanket supplementary feeding program, looking at the situation where we had a lot of cases of acute malnutrition to prevent deterioration in nutritional status and related morbidity and mortality in members of at-risk groups.
This fiscal year, 2022, we are managing 5 FLA. We are using WFP, CRS, commodity management system. We are receiving commodities through several modal transportation, such from air with the air drop and air lift, also from the river using the barge, and also we are receiving food by road transport.
Program quality is one of the key areas that we focus on under programming in CRS because program quality is critical in terms of what sort of impact we then get out of our programming. And it always puts the beneficiary in the middle and making sure that we are addressing the real needs that are out there in the communities. We are providing in-kind food assistance, we are providing commodities to communities, but we are also providing cash assistance where we provide cash where there are functional markets and communities can go out and buy food commodities. The beauty of having cash assistance is that it allows some flexibility in terms of households deciding what are their priorities and then using cash to address those priorities.
In 2022, we had been distributing foods and then we shifted to CVT, which is cash-based transfer, where we give value cash to the beneficiaries. And in this project, we thought of having another complementary an activity that will add another benefit to the community.
Wong ke ayutin ayu koin pandu akela cha ko du chom ku chin ya ni cho ke be ki le ko du thu lo ko ga cha ko du abin ba go chi de abin ba go chi bun chan wo ko ko bun.
We are implementing the project of a school feeding program whereby we are providing meals to 18 schools in Yerul as a county, 11 schools in Yerul West and 7 schools in Yerul East.
There were some irregularities in children's attendance, and when food comes, the number increases.
Besides CRS project management standards, CRS developed several standards on commodity and cash handling, meal, gender and protection. These procedures help the team deliver quality programming and ensure accountability to the beneficiaries and program participants.
The provision of safe and dignified programming is of paramount importance for us at CRS. We have global policies on protection and safeguarding that we have adapted to our context in South Sudan and aligned with WFP's policies on protection to enable us in our efforts at preventing and responding to the abuse and exploitation of children and vulnerable adults.
We believe that supporting communities to provide food for their families, to feed children, to also make sure that pregnant women and lactating mothers are healthy has a significant impact on the health of their children. So it's critical that the international community allow people to secure access to food so that they can keep their families alive and alleviate suffering, but then also that they can support them to transition back to farming and back to self-sufficiency. For CRS, we're really proud to be partnering with the World Food Programme on that in the years to come.